My name is Dr. George Atty, and I am Medical Director at the Worldwide Clinical Trials Inpatient Unit in San Antonio, Texas. WCT is a leading provider of therapeutically focused, full-service clinical research services with a multinational presence and capabilities across all phases of clinical development. At our San Antonio unit, we regularly perform lumbar puncture and CSF collection in support of early through late phase trials. Our capabilities include clinical evaluations, PK sample collections, and state-of-the-art PD and biomarker assessments. In this video, we will cover all of the essential components of the lumbar puncture procedure, including all equipment and materials used, proper subject positioning, catheter placement, sample collection guidelines, safety monitoring, and post-procedure care. We will also review procedures regarding special patient populations and tubing selection. The purpose of the lumbar puncture or spinal tap in clinical practice is to obtain samples of cerebrospinal fluid, or CSF, for diagnostic purposes. For research purposes, samples of CSF are also required in order to measure levels of investigational products administered or to acquire samples of CSF for measurement of selected biomarkers that may either reflect the PK properties of the test agent or represent a reflection of underlying disease processes. The method of acquiring CSF samples must ensure that concentrations of investigational product, as well as effects on various proteins, neurotransmitters, and other biomarkers associated with the study drug, can be evaluated in a reproducible fashion, particularly in multicenter trials. This video illustrates best practices at an investigational center within the United States. As might be expected, patient selection and education is crucial to the success of the protocol. The patient should be fully informed of the procedures and all potential side effects that could result. In some cases, abnormalities in the vertebral spaces may be evaluated by X-ray at the discretion of the investigator to preclude problematic lumbar punctures. Use of a fluoroscope to assist in the procedure is at the investigator's discretion with the consent of the subject. Source documentation should reference the use of a fluoroscope as well as justify its incorporation into the procedure. All protocols requiring lumbar puncture or CSF collection are thoroughly reviewed by the local IRB to ensure patient safety. However, it is possible that not all regulatory agencies would be comfortable with these procedures. In most cases, the subjects will receive a minimum of 2 procedures. A pre-dose tap will be performed using a commercially available lumbar puncture tray and a 22-gauge Whittaker pencil-tip spinal needle. The subject will then complete the defined dosing period. At this point, the subject may undergo a second lumbar puncture or the placement of a catheter using a standard, commercially available epidural catheter tray and an 18-gauge TUI needle. In the majority of cases, the subject will be placed in a sitting position with their feet elevated and back arched similar to a mad cat. In cases where sitting for prolonged periods is not feasible, the procedure could be done with the subject in the lateral decubitus position. Subjects will be assisted as needed to assume the position and maintain it during the procedure. In the event that the opening pressure needs to be measured, the subject should be placed in the lateral decubitus position. Supplies will be opened via sterile technique onto the sterile field. The area around the lower back is prepped and draped using aseptic technique. Using palpation, the appropriate location is identified. Local anesthetic is infiltrated under the skin and then injected along the intended path of the spinal needle. A TUI needle is inserted between the lumbar vertebrae, most often at the L4-L5 level, and advanced until there is a give or pop that indicates the needle is past the ligamentum flavum. The needle is advanced further until there is a second give that indicates the needle is now past the dura mater. The stylet from the TUI needle is then withdrawn and approximately 5 cc's of cerebrospinal fluid is collected in appropriate containers. In most cases, the CSF will be sent for glucose, protein, and cell count. The opening pressure of the CSF may be taken during this collection by using a simple column manometer if this is required. If a catheter is to be inserted, a 21-gauge Portex epidural catheter with a stylet will be opened onto the sterile field. After uncoiling, the tip of the catheter will be inserted through the needle and advance slowly in the caudal direction approximately 5 centimeters past the distal end of the TUI needle. Position in the interthecal space is confirmed by withdrawing fluid through the catheter with a syringe. The distal end of the catheter is threaded through a Lockett catheter securement device. An antiseptic is applied to the insertion site, and the securement device is adhered to the skin. The entire area is covered with a 10 centimeter tegaderm film. The remaining catheter is secured in a cranial direction using benzoin and 2-inch Durapore surgical tape. The catheter can be left in place for up to 36 hours. There are different kinds of tubing that can be used for sample collection. At WCT, Tygon and silicone are preferred. The choice of tubing is dependent upon the investigational product and the pharmacodynamic biomarkers being assessed. Prior to patient enrollment, it is critical that the tubing is tested to quantify possible absorption of the investigational product and expected biomarkers. Once the tubing is selected, it is then assembled and sterilized in an appropriate manner. The tubing is threaded on the Biorad peristaltic pump and primed with normal saline to purge all air from the system under sterile conditions. The proximal end of the tubing assembly is connected to the luer lock tip of the catheter, and this will remain connected throughout the collection period. The distal end of the catheter is capped with a sterile needle until the actual collection time. At the assigned collection time, the Biorad pump will be activated and 2 cc's of CSF will be collected and discarded to clear the tubing. Following this, a 2 cc sample will then be collected in a cooled cryovial, resting in a Biorad fraction collector. Once completed, the pump is stopped and the distal end of the tubing is again recapped in a sterile fashion. The samples will then be transported to the lab where they will be processed per protocol instructions. This process will be repeated to collect all of the required CSF samples. After completion of the procedure, the catheter will be removed. Tape will be removed from the subject's back and shoulder. Sterile gloves will be worn to remove the epidural catheter, assessing the proximal tip to ensure that it is intact. Using sterile technique, pressure will be applied to the lumbar puncture site for approximately 1 to 2 minutes with a 4x4 gauze. A small amount of antibiotic ointment will be applied to the puncture site. Using a 4x4 gauze, the puncture site will be pressure taped with 3-inch Durapore tape. The subject will be placed in a supine position with the head of the bed at 0 degrees. The subject will be encouraged to drink fluids. 12 hours after catheter removal, the head of the bed will be elevated by 15 to 20 degrees every 15 minutes over a 1-hour period. The subject will be assisted to sit at the edge of the bed to dangle feet prior to slowly standing with assistance to ambulate. If the subject develops a headache upon sitting or ambulating, the subject will be assisted in lying down again, and the head of the bed will be reset to 0 degrees. A blood pressure cuff, telemetry monitor, and pulse oximeter may be attached to the subject before the procedure begins if there is concern regarding patient safety. Subjects should be closely monitored during the confinement period in the research facility. Subjects will be monitored for significant changes such as change in mental status, fever, elevated blood pressure, irritability, numbness, tingling, pain in the lower extremities, stiff neck, or headache. Subjects should be instructed to remain lying flat in bed if a headache occurs. Subjects should be instructed to inform the physician and/or research personnel of any adverse effects that occur at any time during the procedure. Any changes in the subject's condition should be documented. Procedures should be completed as specified in a given protocol unless they are not warranted due to a reported adverse effect. In the WCT unit, medical emergency personnel trained in advanced cardiac life support are on site to monitor subjects during the confinement period. Emergency medical equipment, including intubation equipment and pulse oximetry, are maintained on site to administer appropriate medical care should it be required. Subjects should be monitored for any adverse events from the beginning of confinement until discharge. Analgesics, caffeine, and intravenous fluids may be used to treat symptoms associated with lumbar puncture. Generally, subjects are kept in-house for a minimum of 24 hours after catheter removal. Unique patient populations may require additional monitoring and assistance. For example, the placement of the needle and catheter may be complicated by a Parkinsonian tremor or the inability of the patient to achieve full flexion of the back. In this instance, extra support personnel become especially useful to assist with stability and positioning. Likewise, in the case of cognitive impairment, additional staff or sedation may be required to facilitate patient safety. In this situation, a lateral decubitus position may be advantageous. In addition, having caregivers and attendants can help to calm the patient. In all cases, patient safety is of the utmost concern. Due to the potential for underlying morbidity with advanced age, appropriate monitoring and staffing should be considered in this population. Thank you for watching this video. As you can see, while lumbar puncture and CSF collection do pose some technical challenges, the information gathered can be extremely valuable for assessing a drug's pharmacokinetic profile and pharmacodynamic effects. As innovative CSF biomarker and PD studies are increasingly needed for faster and earlier determination of drug safety and efficacy, lumbar puncture and CSF collection are becoming increasingly vital components for drug development.